So a patient comes in saying, oh, I've got sinusitis. Dig a bit deeper. What do they mean? Do they mean that their nose is all blocked and runny? Because that's not sinusitis. Do they mean that they're sneezing a lot and their nose is really itchy? That's not sinusitis. Do they have a cold and a runny nose that's flared up, and now they've got facial pain and pressure and terrible headache, and their nose is all clogged up and their sense of smell is gone, and they've got this stuff running down the back of their nose, and it's hard for them to clear it, but when they blow their nose they get a little bit of green stuff come out? Yeah, that's acute sinusitis. And then how sick are they? Well, if they're sick enough, start treating them. And antibiotics perfectly reasonable in that context, okay? But if you're going to do that, also put them onto a nasal decongestant, because the decongestant will take the swelling down. You take the swelling down, you open up the nasal passages, you open up the sinuses, you facilitate the drainage. And by doing that, you're actually going to get them better quicker than just with antibiotics alone. And then you can add in the saltwater spray. And in fact, there's even evidence to show that nasal steroid sprays in the acute setting are worthwhile. So from that point of view, that's, I guess, hopefully answering your question in terms of don't take the patient's description of them having sinusitis as actually being the diagnosis. Dig a bit deeper, try and clarify what exactly it is that they mean so that you can get a better understanding of what their actual clinical condition is, not what they're calling it, and then treat appropriately. So hopefully I've answered that for you. All right.